asked me to come and speak about integrated child and family services and collaborative practice, and then she gave me a title that said something like Social Policy for Inclusion in Australia, and I went, right, thanks, June. Okay, so I'm going to try and do a little bit of both. And I'm really talking about social policy for social inclusion, but using the work we've done around integrated services and collaborative practice in child and family programs as a focus. So the research that informs this talk comes from a number of projects. The Integrated Services in Provision in Australia project that was funded by a group called the National Professional Support Coordinators Alliance, which are a group of organisations throughout Australia that are responsible for delivering professional development to Commonwealth-funded childcare services across the nation. And Dawson, who will speak to you later today, is a member of that group. Also work around a resource that was also funded by the same organisation that was targeted to help professionals be better at integrated ways of learning when they come from different disciplinary backgrounds in terms of what they're doing in their work. Collaborative practices research that was funded by the Victorian Department of Education and Early Childhood Development, and some ongoing work with the Infants Home in Ashfield. And down the bottom you'll see that this is not my work alone, it's work with a number of colleagues, but I'd particularly like to acknowledge the work of Dr. Sandy Wong, who's in the audience, because she has taken a lead role in a number of these projects and is a very, very valued colleague. And in fact, a couple of the slides I'm going to show you that are the more interesting slides come directly from Sandy, so I have to acknowledge her. So what is our social policy environment? Well, a little bit like the UK trajectory, we had a period of early childhood reform under the previous federal government, which got the buy-in of state and territory governments through the Council of Australian Governments project. Council of Australian Governments, no project at the end, COAG. And through that reform agenda, a few things happened. We increased the availability of preschool education, at least in the 1 year before school. So not as ambitious as what the research tells us would make the biggest impact, but in a nation that did not have universal access to preschool education, a significant symbolic step. We've had reform to the regulatory and standard setting environment for early childhood education and care to improve the quality of programs delivered to young children in the years before school. And we had some important support for integrated child and family service provision. So the bringing together of services in education, health and welfare around families and children, but not to scale, in pockets around the nation. We've since had a change of government, and I think we don't fully understand what the new landscape will be. But I think we do have to acknowledge the recent Productivity Commission review of childcare provision, because it does a couple of things that I think we need to be very cognizant of. One, it foregrounds workforce participation over children's child development and learning in its terms of reference. So it's really seeing childcare as support for parental workforce participation. I think that this is important because, of course, parental workforce participation is a very effective anti-poverty measure, but not if it's at the expense of the quality of what's happening for young children. The other thing that it talks about a lot is flexibility. And I think if we listen to the rhetoric of flexible childcare against the rhetoric or the increasing focus upon subsidies for nannies, we might be looking at a very different early childhood system down the track. If we want to have an impact on helping those families and children that are currently on the margins, this is something we really have to be aware of. I think we're also again seeing a trend toward targeted funding to areas of high disadvantage as opposed to a notion of universalism. I think preferably you have both things. You have a universal base with increased funding for areas of high need. We're not sure where that will play out. But my last point really relates to this sense of the tradition of integrated services for children and families, and I want to acknowledge Sandy's work here. And if you've been asked this question before from a presentation from Sandy or I, you're not allowed to answer this question. When do you think the first integrated child and family program in Australia started? I'm happy to take guesses from the floor. This is audience participation. Early 1800s, not quite, but pretty early. Any other guesses? Okay. 1921, in the Woolloomooloo Mother and Baby Clinic. And it's interesting to me the way we don't know our own traditions, our own policy traditions in child and family services in this country. I think we have a short memory. So Woolloomooloo, for those of you that are not from New South Wales or Sydney, a highly poverty-stricken area of inner city Sydney at this time. This is what the Woolloomooloo Mother and Baby Clinic had. A kindergarten that was run by the Kindergarten Union, the Kindergarten Union Association, a day nursery run by Sydney Day Nursery Association, a teacher's room, a sleeping room, an isolation room where the wee ones may be isolated in case they develop measles, whooping cough or any of the complaints prevalent amongst those of tender years, a medical clinic, a mother and baby clinic, a community milk depot, an open-air play area and sleeping, living quarters for the day nursery staff because they lived on site. So this was hailed at the time as an Australian first and perhaps a world first for this type of program because people knew that services had to be wrapped around children and families at the time. But, same old story, a few years later there was a change of government and it lost its funding. Again, in the 1950s, we had policy talk about needing to wrap around multiple services for children and families. In the 1975 Fry Preschool Commission report, Fry report, Joan Fry was talking about the need for integrated services for children and families. Here are two publications from the Australian Early Childhood Association, which of course is now called Early Childhood Australia, 1983, 1994. We have a long tradition of trying to do work in this area, but somehow we never seem to bring it to scale or spread the lessons that we've learnt from that work. And I can't help thinking that in the early 2000s, of course, Australia participated in the OECD thematic review of early childhood education and care. And one of the rapporteurs, cheekily and on the side, not in the main report, of course, about Australia, did whisper that Australia was the land of the pilot program. So we love to have an innovation and fund it for a few years and then shelve it and reinvent it 10 years later. And I'm hoping that we won't do that this time. So some of the progress that we've made in the policy area is that we've got support for changing aspects of the child and family services system, but not in all jurisdictions. So I know I'm talking to mainly Victorian audience, and when I talk further about some of the challenges we're facing around integrated child and family programs, I'm sure some people will say, oh, we're better here. But the thing about Australia is it's a diverse country. Every state and territory is different. The service system is very different in every state and territory. So progress is uneven, but also the challenges that each jurisdiction faces are often quite different. And I might also say we suffer from this issue, I think, that every jurisdiction thinks actually it's got it right to some degree and the other jurisdictions don't. There's not good understanding in that cross-talk about what's happening. We have some really excellent integrated child and family programs, and I think looking at Doveton this morning, throughout the country, We've got some very sophisticated work happening around providing a range of supports to families in education, health and welfare, and doing it very well, but it's not brought to scale. I think one of our other strengths is that we've got genuine on-the-ground commitment. So we've got large-scale early childhood providers, we've got one-off providers, we've got welfare providers who are involved in early childhood education, really trying to reconfigure what they do to reach those families that they realise have been missing out. But these are the commitments of individual organisations rather than something that's necessarily happening across the board. And we also have, as I said, diverse models. And I think diversity in some ways has been a strength because models have emerged in response to the very specific community challenges. So what are our challenges? Well, the first is, what are we talking about? When we first did our integrated services research that was national, and when we did it again for Victoria with the collaborative practices research, when we talked about integrated child and family services, or when we talked about strong interprofessional collaborative practices, it became clear to us when we hit the ground that nobody had a common understanding of what we were talking about. People use terms like integration and collaboration. They are very clear in their own minds what they meant by those terms, but the shared understanding simply wasn't there. So one of the first things that we did, and sensibly, it was one thing that the Professional Support Coordinators Alliance asked us to do in the first instance, was come up with a definition of integrated services for the Australian context. Now, you might be able, can you see that okay? Is it, okay. So don't worry about that, we'll go on to the next thing. We had a working definition which guided the services that we targeted and talked to for our case studies. But then we put together a definition and ran it past a group of people that have been involved in integrated programs for some time. And these are the elements that we came up with in our definition. That integrated services recognise the impact of family and community contexts on children's development and learning, and focus on improving outcomes for children, families and communities. They provide access to multiple services to children and families in a cohesive and holistic way. So we were trying to move away from this notion that co-location was integration, or that just referral systems were integration. We were really looking for those qualities of cohesion, and they operate through respectful and collaborative relationships with families and the community, as well as interprofessional relationships, and actively seek to maximise the impact of different disciplinary expertise in a shared intent to respond to family and community contexts. We were really trying to shift away from the notion that just because you work with another organisation, you're providing an integrated program. It's not just doing more of the same alongside one another. I actually think it's about working differently with children, families and communities. And then there's that notion, of course, of horizontal continuity. The child and family move across settings at one point in time if they have multiple needs or challenges that they're facing, and the vertical continuity, the child's developmental transitions over time. One interesting thing about Doveton is that birth to end of high school focus that it has. I think one of the transitions that's often very difficult with integrated programs is from what happens to children when they hit school. So that transition into the school area is often very difficult. Okay, so it's challenging work, and I think there are challenges that operate at the structural level, at the policy level, and at the individual professional level. So some of the challenges that we've uncovered in trying to deliver effective integrated child and family programs are inflexible funding streams. Services are often reliant on multiple funding streams, so health, education, community services, that have multiple accountabilities. And then when you have multiple accountabilities, you've got a huge administrative burden because you're spending a lot of time reporting back to different government funding streams to say you've spent the money well, but that might not actually have any reflection on what you're doing in working in an integrated way. One thing Australia has moved to, as I'm sure many countries in the world have, is this notion that we're moving away from regulatory burden by having an outcomes focus. And that sometimes means we're not focused on inputs, we're focused on outcomes. And I think there's something very attractive about that. As long as we all have reached these outcomes, everything's hunky-dory. Well, it's more problematic than that. But one problem is, like the Shore Start experience, we're often seeking evidence of outcomes too early. And actually the work of integrated programs is very, very difficult. It's around building trust with communities and families. It's about building professional trust and good working relationships. It's about taking risks and learning to do things in new ways or different ways. These are all time-consuming matters. And sometimes I think the focus on the outcomes is too much too soon. Similarly, the notion of no wrong door. I think the no wrong door notion is really important, but not if there's no door. So we have to get the infrastructure right that supports services. It's great having flexibility and the capacity to work together, but if there isn't an actual functioning service system, you're not doing much good. Another is the lack of resources really that are allocated for formal and meaningful evaluation. So I'm sure there are a lot of service providers here that fill off forms every year to account for funding. They get filed in a filing cabinet somewhere and you wonder what you've done with it. And does that form filling or evaluation actually provide you with meaningful information about the effectiveness of the work that you're doing with children and families? Okay, so I think we have to think about evaluation in new ways, and I know Doveton is doing that, and I know a number of services are doing that, and services are in fact developing evaluation mechanisms for themselves, but we really have to start getting that alignment between what funding bodies are asking for and what services are doing so it's meaningful for both parties. Professional challenges, okay. So there's a lot of gatekeeping by individual professionals about their own expertise. There's a lot of, we found a lot of challenges about language and meaning that I'll talk about in the next slide. And there's a lot of sense if you're working with other professionals, this notion of what's your professional identity if what you're doing is placed under scrutiny by other professionals that you're working with that might come from different disciplines. There's also structural barriers, inequities in status, who's perceived to be most important, the health worker, the educator, the childcare worker, who's got the most status. There's inequities in remuneration and conditions, and there's expectations of work that's hard to break. So I'll come from the early childhood education and care angle. Early childhood educators have to meet outside work hours unless they get lots of other funding because they are tied to very strict staff to child ratios on the floor. It's often very difficult for teachers from schools or health workers to say they'll come to an evening meeting. It's not within their process of working. So there's all these kind of expectations we have about our own work practices that are hard to shift because it's also to do with our professional identity and what we see as appropriate wages and appropriate working conditions for us. It's hard to shift in those integrated spaces. And of course, the other thing is, it amused us greatly when we went around the country. One of the biggest disputes was who was entitled to a car park. But I think there's also a lot of gatekeeping that's now happening in terms of pre-service training, professional qualifications and education. As more accountability happens in terms of course content for people that are going to be nurses, health workers, educators. We're losing a lot of flexibility in undergraduate programs in terms of giving people the professional skills that enable them to work together with other people. So I used to coordinate a double degree at the university that I work with, a Bachelor of Early Childhood Teaching, Bachelor of Nursing. We've given up. When that degree first started, there was a lot of flexibility between both registration bodies, and they were prepared to recognise the competencies across the disciplines, but it has now become so rigid, it is too difficult to do. But it was also a very interesting exercise because of the professional gatekeeping that happened to our students, where the nurses would say, well, what are you going to be, a teacher or a nurse? What's the point of that degree? And the teachers would say, you can't be a real teacher if you're studying health as well. So a lot of kind of non-recognition of the powerfulness of actually understanding something from multiple disciplines. So I wanted to talk a little bit about, I must have moved it, the language. When we talk to people in integrated programs, they use terms like child-centred and family-centred, and I think there often wasn't a lot of unpacking of what that meant underneath. But then there were also tensions between people that had a child-centred approach and people that had a family-centred approach. And it might be, and I think one of the problems is unless you allow time for people to sit down and really dig underneath what this means, you've got problems. So a great example is, for instance, the playgroup. In a lot of the programs we visited, there were playgroups attached to either the health centre or the early childhood education and care program or the school. If it was a child-centred program, it usually had an early childhood qualified person working with that playgroup and the families, a lot of activities set up for the children, a lot of work with the families. If it was just seen as family-centred, there was often very little equipment for the children, very poor equipment for the children, very poorly organised activities for the children, and a lot of cups of tea with the families. There wasn't really an interrogation of what was meant to be happening. It was just something, we should have a playgroup, we'll do it. So there has to be a lot of unpacking of what's really expected. Strengths-based, are there really strength-based approaches in those services? And what does that mean? Does it mean you overlook the challenges that families and children face? So I think we've got a lot of rhetoric, but a lot of unpacking that we have to do. And whether you're working with individuals and children as clients, or whether you're working with the whole community and seeing what the structural facilitators and barriers of that community might be for the families and children that live there. So this is an example of some of the professional tensions that we unpacked, and these are the words from the people that we interviewed or who responded to us by survey. They found that there were different images of childhood and different beliefs about child rearing and motherhood in particular. So how mothers were viewed. Should they be at home? Should they be in the workforce? Were they seen as good mothers, doing the right thing for their children, or not? Embedded beliefs within individual disciplines about the value of each discipline. Underlying hierarchical beliefs. Adherence to old ways of working and rigidity about professional boundaries, busyness of service and lack of time to reflect. Okay. So in the services that worked really well, and I won't keep you much longer, we found a lot of good things happening. One is, though, they were pretty good at rule bending and risk taking, and they had someone who was kind of nousy enough to work the system, okay? So they kept the government funding bodies happy, but they pulled together good supporters in terms of governance and leadership. They really worked hard to break down both the portfolio boundaries of government and the professional disciplinary boundaries. They tended to have very good governance structures, and they tended to have a champion within that service who really knew what integrated child and family programs were about, what they were trying to achieve, but at the same time, not only was that leadership kind of strong and vibrant and prepared to push things forward, it built up leadership from the ground. So it wasn't the solo leader, it was both, there was power both vested in that leadership but distributed amongst the community and the staff that worked within there. And there tended to be a lot of attention to the ethos of the centre. So there was a lot of time spent building a shared vision and shared intent, what was to happen for those children and families in that community, a lot of family and community engagement, a lot of people being on the same page to guide the work that they were doing. And in the end, people kind of said, you know, this work is really hard. It is really, really hard, and people were professionally stretched and challenged, but it actually made a difference. So I just want to share a couple of quotes. So this was from something that someone wrote in. Examination of service delivery from child and family point of view highlighted internal systems barriers to access for families, particularly for those who are less confident, least proficient in verbal and written English, or those least likely to persist. So until this organisation took this journey, they hadn't really paid attention to how people were excluded from the service that they were delivering, and they changed what they did. Another person wrote, the trusting relationship built up is empowering. We assist each other as we recognise that everyone has something to contribute. We recognise that we're dependent on each other and we expect the best from everyone. So this shift from the problem-solving, solo, sword-waving professional who's going to save the world to this recognition of the interdependence upon one another for making a difference. And I think that the slogan for today is together we can make a difference. Another thing that one of the organisations put forward from their integrated journey was that together we are much stronger. I haven't got quotes from families here, but families talk about actually arriving at a program that actually cared about what was happening for them and their children, having a sense of belonging, having a sense of family, and having a sense of community that hadn't been available before, where they'd just been shunted from pillar to post, trying to find the best match of services for them and their families. Okay, so I might leave that because I think we've all had a very long morning, but I'm happy to talk to people over lunchtime, and I believe we're going to have some questions later, June.